Hey, everybody. Welcome to the first week of Healthcare Law and Ethical Considerations. I'm John Rhodes. I'll be your instructor for the next 8 weeks. Very excited to start this new class with you. You'll see that throughout the course of the next 8 weeks, I will post these videos every week to give you some additional detail and tips on the assignments, feedback, general feedback, and things like that. So I am going to sort of introduce the class this week, and at the end, I will talk to you a little bit about some keys to success in this class. I've taught this class for, oh goodness, it's been almost 2 years now. I've been teaching this class. Maybe a little bit more than that. I don't know. 2.5 years for Southern New Hampshire. And I do enjoy this class. You see in my bio my experience with healthcare. I'm a healthcare lawyer. My entire legal career has been spent doing healthcare work, mostly healthcare regulatory work, but I've done a variety of healthcare things throughout my legal career, and I often tell people I lucked into the healthcare practice because that's the job I applied for when I was a third-year law student for the first law firm I worked for, and I've pretty much been doing it ever since. So both in-house counsel and also currently I work for the law firm Fenimore Craig. I'm also the chief privacy officer for my law firm. So I deal a lot with HIPAA and just data privacy in general. So and we'll get into that a little bit later. So look forward to having you guys in class. I've been working from home for I guess about 3.5, 4 months now. Probably 4 months. Beard. So this is been working home from 4 months beard, and probably not returning to the office anytime soon. So hope you're all staying healthy and safe, and please let me know. So these videos, please let me know if you have any questions throughout this course. These videos are typically going to be between 10 and 15 minutes long, so hopefully not too time consuming, but just enough to sort of recap the previous week, introduce the next week, and talk about sort of tips on what I have seen to be successful assignments, sort of successful mindsets, approaches to different assignments, and we'll together work through all this material. So, the concept of ethics permeates the healthcare field, and we're seeing that in the news. We see it every election cycle. To be honest with you, is healthcare a right or a privilege? All the end-of-life issues that we're going to be talking about, both at the beginning of class and the discussion questions. The last 2 weeks of class cover this. Insurance coverage, denying coverage due to pre-existing conditions, even things like narrow networks, plans that carve out or try to carve out high-cost patients, or even the concept of for-profit insurance companies. I mean, regardless of where you stand on that, it doesn't really matter. I mean, it's an issue in healthcare, and ethics conversations, particularly in the world of healthcare, can quickly. It seems like these days everything's political, but healthcare has always been a very political issue, and so ethics in healthcare can quickly turn into a political discussion, and my advice is to really try to avoid that. I like to avoid any political discussion. I like to make sure that we keep it respectful in our discussion questions. I've only, in the last 2.5 years I've been teaching this class, I've only had to call out one student for expressing an opinion or a counter opinion to a discussion post that probably wasn't as professional and respectful as it should have been. So it's largely not been an issue. So, but I just like to call that out at the very beginning to make sure we're cognizant of that as we go through this. Because I mean, we all have opinions. And we're not here to say what's right or wrong. I think I'll get into this a little bit later. I think you'll find in this class I'm not so concerned about a right answer, because I don't know what the right answers are on a lot of these things. I'm more concerned on how do we develop that answer? What is our analysis? And how is that analysis structured? Is it reasoned? Is it reasonable? And if so, then that's enough for me. If you have a reasonable analysis, you're using the right facts, your conclusion is going to be reasonable if you're doing that analysis right. So that's what matters. You'll find in this class it's separated into two very distinct parts. There's the legal component, which we'll tackle first, and then there's the ethics component. We're all going to study the same case, the Ituraldi case. We're all going to study the same facts in that case. There's a link to it in your in one of the rubric sheets. But we're going to discuss the legal components and the ethics components of this case. And so as we go throughout this class and we're talking about not just the case, but the different issues that we're going to be covering in the text and in the materials, you'll find that legal issues and ethics issues can often, while at times they are very distinct, but they can often converge and overlap. Some of these issues, I just want to bring up a few of these issues that we'll be covering throughout this course. Just not through our discussion questions, but in the material that you'll be reading over the next several weeks. In chapter 10, there's an issue. Here's a hypothetical. A physician from another office steps into your office and asks to see the chart of a neighbor whom he believes may have an infectious disease. He states that the neighbor is a good friend and that she will not mind if he reviews her medical chart. Is it legal for you to give the chart to this physician? So then the question is it permissible? And should it be? Is there a legal component to this? Is there an ethical component to this? Well, most of my students, I assume that's the case for all of you, are already in the healthcare field, are largely clinicians of some sort. So that there's most certainly a legal component to this. And we're going to get into a little bit about privacy. I think it's week 4. I think maybe the week 3 or 4 discussion question. We talk about a HIPAA hypothetical scenario, and the answer to that question largely depends on the facts and the rules, and we'll get into that as we talk about how to do an analysis. So one thing I will warn throughout this class is not to look at an issue like this, like the one I just read, and just say, oh yeah, that's most certainly not legal, that violates HIPAA. Well, maybe, but it's one thing to sort of conclude that just off the cuff. It's another thing, and the objective of this class, to go through that analysis. What is the issue? What is the rule? Apply the facts to the rule, and then come out with your conclusion. That's the structure of the legal analysis that'll be required throughout this course. What about someone who presents to an emergency room and needs urgent care? What if the person doesn't have insurance, or that particular ED is out of network with the patient's plan? Is it legal or ethical to turn away the patient who is in need of emergency care? Well, for those of you that work in an emergency department, know that that's not legal. There's a federal law called the Emergency Medical Treatment in Active Labor Act, or EMTALA, that prohibits this and requires a medical screening and stabilizing care be provided before you can even ask about insurance. So that's required. So to me, this is a great example, EMTALA, of how we as a society we have said, look, if someone's in need of some serious urgent care and there's a legitimate emergency that needs to be treated, regardless of whether the patient has the ability to pay, or regardless of the insurance status, that just as a right, as a human right, and now as a law, that patient deserves to receive that stabilizing care. Now, beyond the stabilizing care, this law doesn't cover it. So that's a totally different question about whether or not we um, whether we have the inherent right for ongoing healthcare. But in terms of emergency situations, we have decided collectively as a society that that is an ethical issue, and have codified that into a law to make it not just unethical but illegal. So things like you can't patient dump if you can't ask about insurance, can't patient dump. You can't reverse dump. That's an EMTALA issue. So you can't refuse to accept transfers if you're in a legitimate certified emergency department. So that to me, that's a great example of how the an ethical issue in healthcare and a legal issue in healthcare sort of converge and overlap one with another. Things like we're going to talk about false claims with respect to government payers and government programs like Medicare and Medicaid and government managed care programs. False claims, reverse false claims. What if you're an employee who discovers an error in billing that has caused an overpayment? What do you do, and how does the facility or the healthcare company or hospital, or whoever it is, react to that? And how they react to that really depends. Will sort of drive how much liability there is, if at all. So again, we're going to talk about these later, but it's the analysis. What is the issue? What is the rule? What are the facts? Apply the facts to the rule and come out with your conclusion. We'll talk a little bit about scope of practice. We'll talk about physician codes of conduct, nurse codes of conduct, things like that. I've done a lot of different things in healthcare, but I've only had two physician disciplinary cases where I had to go before the state medical board to defend two different physicians. One was a GI doc, the other was a neurosurgeon. So, my takeaway, and those are always the best stories in terms of just craziness. But, in terms of lessons learned for me and advice that I provide to others based on those experiences is don't lie, don't mess with medical records. Be open and transparent is always the best way. Okay, so just a brief introduction in terms of the key that I want you to, as you start on in this class, the key I want you to understand is just the two different components that we're going to be studying. And we're all going to be studying the same case, like I said, but there's going to be a legal component, there's going to be an ethical component. The first week or two, we're going to be sort of just diving in to introduce some of these principles and concepts. And then from there, we'll dive deeper into that case, and we'll dive deeper into those individual components. So keys to success in this class. Number one is please engage. Be engaged. Have fun with material. It's very interesting stuff. The stuff that we're going to talk about is really fascinating. Legal issues and ethical issues are always great in terms of interesting and sophisticated discussions. So please be engaged. Engage with your classmates. Engage with me, and I think we'll have a good time. Turn in assignments timely. I am totally understand that things come up. I was also an adult learner. I had kids when I went to school. I had two kids when I started law school. They were ages 4 and 2. So, and then I had my third, right before my third year of law school. So I totally understand that things come up. But please, I just prefer to know ahead of time, rather than after the fact. If stuff comes up and we need to sort of rethink some deadlines, but so please just let me know. I'm here to sort of facilitate the discussion. I'm here to facilitate your learning, and I want to be able to do that effectively. For me, I'm not here to just think about grades are important, obviously. My primary objective is to make sure you get value out of this class. And so I want whatever it takes, whatever I can do to provide value, I'll do that. Let's just work together on making sure you get the most value out of this. Third thing is, please watch these videos. I don't care if it's not about me. I don't care if you're watching me or what it is, but I think that a lot of contemporaneous feedback, discussion, things that I'm reviewing at the moment come out in these videos. So please, I mean, this one's going to be longer than normal, but just because we're introducing the class. But please watch these videos, and I think you'll benefit from it. Finally, I just want to emphasize, you'll see in your textbook a method of legal analysis called the IRAC method, IRAC. And that stands for issue, rule, application, or analysis. So you're going to apply the facts, and the conclusion. To me, this is the most valuable thing that you'll take out of this class, is learning how to analyze issues using this method. So it's very simple. I'm very structured in terms of how I want to see assignments. Give me the issue, give me the rule, apply the facts to the rule, and then come out with your conclusion. It's very simple. Issue, rule, analysis, conclusion. Don't deviate from this, and you'll be in a good spot. Show me the steps in your analysis. For me, facts are very important. So use facts in your analysis. The more detailed the facts, the better the analysis is, to be honest with you, whether they support or not. I mean, the facts are the facts, and it makes for a much more in-depth and much better analysis if you're actually utilizing specific facts from the case, and talking specifically about the case that we'll be studying in this class. So use facts in your analysis, apply the rule to those facts, and tell me why they apply or why they don't, and then come out with your conclusion. Like I said, this class is all about analysis. When you're talking about legal components, we'll talk about specific elements. There are 4 elements to the main cause of action we'll be talking about in this case, which is medical negligence. Those 4 elements are duty. I think your text refers them to as the 4 Ds, and I don't remember what each D is, but duty, breach of that duty, the causation, and damages. So those are the 4 elements. Each of those elements needs to be analyzed using that IRAC method, because, and this is important, because even the absence of one of those elements means there is no medical negligence. So no matter how bad the facts are, if you can't show causation, if you can't show damages, if you can't show a breach or a deviation from the standard of care or a breach of that duty, then there is no negligence. So that's important, and we'll get into this a little bit later. We'll cover some substantive law, but it's really, to me, it's how you look at legal and ethical issues, how you analyze them, that will give you the most value in this class. So again, I'm super excited to have you all here. Looking forward to the next 8 weeks. Please reach out if you have any questions. I am around. Like I said, I'm working from home, so I'm pretty available. I do work during the day, but feel free to text me. Students have texted me in the past, and we've either been able to resolve questions over text, or we'll set up a time to talk. Always open to that. So just feel free to contact me, and we'll have a great experience together. So have a great week, and we will talk to you soon. Bye.